Thank you, Brian. All right, it's 3:01. I'm gonna go ahead and call the meeting to order. We will be meeting in closed session, but I will announce that in a minute. Let's go ahead and do pledge of allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. And board members present. I have Shelley, I have Sherry, I have Ken, and Rich, you're online, yes?
Yes.
Thank you. All right, so do we have any, we do have some modifications to the agenda that I would like to suggest. We are going to move number 21. And we're gonna take that item just after item number 16, unless anyone has any objections. And then for item number 17, we are going to discuss setting up the investment account with class, but we will probably be tabling the policy approval itself because we're going to be making some additional changes to that.
Okay.
So any other comments on the agenda items?
Nope.
Thank you. Okay, then I will accept a motion to approve the agenda.
Move to approve.
Thank you, Sherry. Do I have a second? Thank you, Shelley. All in favor, Rich?
Aye.
Ken?
Aye.
Sherry?
Aye.
Shelley?
Aye.
And I'll vote aye. All right, that moves us into our public comment period. Forgot to ask if we had any ahead of time.
I should have let you know, we did not receive anything online via mail or the telephone.
Okay, thank you. Anyone in the room or online want to make public comment? All right, then we will move on. Thank you. All right, so that brings us into our closed session. We will meet in closed session pursuant to Government Code 54956.9D1. Conference with legal counsel, existing litigation, Robles versus SHD. Government Code 54956.9D2 or 3, conference with legal counsel, anticipated litigation. Safety Code 32106, reports involving trade secrets, and Government Code 37624.3, Health and Safety Codes 1461 and 32155. That will be a report on quality assurance. And with that, we will move into closed session. Thank you. I think the rest of the folks need to get read. Oh, did it admit them already? Folks from the waiting room?
Judy should be joining momentarily.
All right, closed session is closed. We are back in open session. No reportable actions were taken during closed session. John, if you're still with us, I'm thinking you might like for us to skip ahead to number 16, so you don't have to hang around for the rest of our meeting, since our close went so long.
Tab E.
John, are you there?
I sent you my message.
Okay,
Let me see if
I am here. I just.
there you are.
And so I think you were talking to me before I was let in.
Sorry, John. Yeah, no, I was thinking that since you already sat through all of our close, we might want to skip ahead and do number 16 now. That way you don't have to stick around for the rest of our board meeting.
That's up to you guys. You know, I don't know how much I love listening to board meetings, so I don't know.
You know you miss it.
Is that Sherry Thrall's voice I'm hearing?
Uh-oh, yep.
It's up to you guys. It doesn't matter. There might be a moment just because of the timing because I'm having to be at my house. I don't know if anyone shared with you all, but my dogs might start taking off and I'll mute myself if that happens until they calm down.
Sounds good. So are you wanting us to go back to our original order, John?
Do
We're
what you
fine.
want. Yeah, go ahead. I'll mute myself and I'll just be here when you guys are ready for me.
Okay, great. Thank you, John.
Okay, all right.
All right, so no, we'll go back to the agenda item number 10, which is approval of the special board meeting minutes for October 24th, 2023. Board members have had a chance to review. Do I have any questions, comments, or motion to approve?
I'm going to move to approve both item 10 and 11, the special board minutes and the regular board meeting.
Thank you, Sherry. Do I have a second?
No, sir.
All in favor? Sherry?
Yes.
Shelley?
Aye.
Ken,
Right.
Rich,
Aye.
and I'll vote aye. Thank you for helping move that along. All right, so now that brings us to number 12. Reassignment of the December 2023 regular board meeting date. So we do have our special board meeting for our audit on December 20th, our audit presentation. So we are suggesting that we move the board meeting, regular board meeting for December, since it falls the week of Christmas, that we move it to the following Thursday. I wanted to see what board members' availability was. I'm proposing the 4th at 3 p.m. So what do board members think about that? No, no, moving December, let's see, let me double check the date of it. Moving our regular meeting from
Yeah,
December
January 4th.
28th to January 4th for our regular meeting.
I will be in Hawaii
You will be in Hawaii that whole week?
for 2 weeks. We'll leave you the second, come back the 16th.
Oh, wow.
You need anybody to carry your luggage?
It's our 40th anniversary.
Well, congratulations
Thank
early.
you.
Fantastic.
Well, what about, so you're not coming back till the 16th?
Mhm.
Okay, so we may just, are there other board members available for January 4th at 3
I am.
p.m.?
January,
January 4th at 3 p.m.?
I am. The 20th, it's the audit meeting.
Yes, the audit presentation.
But we can also elect officers on the 20th, can't we?
At a special meeting, I don't know if we can do that at a special meeting. Do you know, Sherry?
I don't think so.
I think it has to be a regular meeting. So I think we have to wait till January.
Till the 4th.
Yeah.
Okay,
Ken, are you available?
I think so.
Okay. So we will say January, do I have a motion to approve reassigning the December 2023 regular board meeting date to January 4th at 3 p.m.?
I so move.
Thank you. Do I have a second?
Second.
Thank you. All in favor, Rich,
aye,
Ken,
Hey,
Sherry,
Aye.
Shelley,
Aye.
and I'll vote aye. Thank you. All right.
I know you're gonna call it. I don't know why.
What we're gonna be doing?
All right, that brings us to number 13, proposed changes to salary and or fringe benefits of the chief executive officer. Oral recommendation regarding proposed changes to salary and or fringe benefits presented by myself and Secretary Crandall. So Secretary Crandall and I, we reviewed the market, that information that we got from HR. We also reviewed Transparent California and the controller's website and all of that stuff. And so our recommendation, and after discussing with John as well, was for a 3-year contract at $280,000 per year with 40 days of PTO per year. So that was our recommendation. And now it moves us to the discussion and possible approval of those changes and execution of the contract that we have included in the board packet. So I'm open up for discussion, comment, motion to approve.
There was a discussion or a look at some restrictions on termination. Was that settled? I know we were checking with our.
Yes, we did settle that, and
we need a motion before discussion. I so move.
thank you, Rich. Okay, thank you. So which tab was that again? Sorry.
Steve.
Got me lost. Thank you.
Need a second.
Thank you.
I'll
All right,
second.
so, thank you, Ken. So to your question, what we have put in the contract with our attorney's verbiage
Okay.
was that if the employee is terminated without cause, the change here was
I was looking for that.
in section
E,
E, yes, thank you. So it is in that,
Oh, yeah.
that section in E,
Mhm.
so notwithstanding any provision in this agreement to the contrary, in the event that 3 or more members of the district's board of directors in office as of the effective date hereof lose their seats in the November 2024 election such that they cease serving as directors of the district shall not, for a period of 90 days following the date in which these newly elected directors are seated, terminate employee without cause. So 90-day period cooling off period, if you will, so that any new directors can get to know the administration, get to know Sean, and before any decisions are made.
Good.
Makes sense.
Okay,
It makes, and his PTO increased from what to what? 30 to 40.
from 30 to 40.
Okay,
Mhm.
seems reasonable.
All right, any other discussion?
Been moved and seconded.
All
Yeah,
right, all in
yeah.
favor? Sherry?
I,
Sorry, I keep looking at Shelley and saying
Aye.
Sherry.
Shelley,
Shelley, Ken,
I,
Rich,
Aye.
and I'll vote aye. Sorry, I don't know why I keep doing that. All right, moving on to number 14, medical staff report. Requesting board approval. Following medical staff appointments as approved at the med staff meeting held on November 14th, we have a slew of reappointments. And we have a few new initial appointments, radiologist, so a locum, another couple radiologists, and then we also have reappointments for some couple allied practitioners. Do I have a motion to approve medical staff appointments?
I approve.
You move, thank
Make a
you.
motion.
Do I have a
Second.
second? Thank you. All in favor? Sherry,
Yes.
Shelley,
Aye.
Ken,
I,
Rich,
Aye.
and I'll vote aye. Thank you.
It's the SH and the SC.
It is, I think. Okay, next we have our policies and procedures. A bajillion of them. So do we have any questions, comments on policies and procedures?
They are on the table if you need. to
Yeah.
look at them.
And you put them on my binder.
I
Thank
did,
you.
yeah.
I had a question with all the ones that are being rescinded, namely all the pharmacy ones that are, the policies that are being rescinded. There's so many. Why? Were they included in other policies or, I mean, there's just so many.
Yeah, Shelley, I can speak to that. Many of them are being rescinded because either they were outdated or they have been put into a more recent policy or some of them just required, they were just too far outdated to even mess with. It was easier to just start over. And
Okay.
some of this is a result of our visits by the Board of Pharmacy that we've had over the summer. And so we're just really cleaning up things surrounding the drug room and the new requirements by the Board of Pharmacy that changes the way that we're able to restock our Pyxis among many other things.
Okay, perfect. Thank you, Judy.
Thank you, Judy. And Judy, do you want to speak at all to the policies and procedure software that you guys have been looking at?
I can talk about it.
Yes, sure.
Or Brian is.
Yeah, Brian and Charlene are really in charge of that, but we have had our first initial meetings. But I'll let Brian speak to it.
Okay, thank you.
Sure, yeah, we had our first two kickoff meetings. We had our internal kickoff meeting. We had the initial meeting with the managers last week. We're going to be starting to load these policies into play, shooting for, I believe, February for all of the policies to be in there and for the managers to start the update. And that's when the training will happen, where you start seeing the process of the updates, the changes in them, and that will go away.
Yay, fabulous.
So what's the name of the system?
MCM,
MCN.
yes. We'll be able to use it for a few other things, like the downtime forms, put them in the cloud and make sure everybody's getting one place.
Okay.
Sounds great.
what's the process for bringing staff up to speed on the changes?
Part of the process is that it's using our Active Directory. So when an update comes into place, staff will be emailed notifications
Yeah.
right now instead of a posting somewhere or something like that. We can also, there are tools in there that if we want somebody to read something and sign off on it, we can do things that they can do.
It just occurs to me, in my experience, when we modify a policy, create a new policy, a lot of times there's a lot of questions about it. I'm wondering, is there a forum for that, for,
Inside of that.
everybody on the same page?
Not for the employees, not quite so, but for, the process of approval, there is. But no, and that's probably something that, as we're looking to build our SharePoint and our internet at the beginning of the year, that's something we can probably encompass in there.
So Brian, so when managers of these departments have staff meetings with their staff.
Yeah.
Isn't it incumbent upon those managers to mention there's a new policy, we have a new procedure,
Well,
and then have staff read it and sign off on it?
that's correct, but we can automate some of that as well.
Yeah,
So-
and they put it on so they can
Right.
go on and,
Right.
When they have time.
yeah,
Right,
well,
especially when you have per diems or second, third shift. You know, one of the things when we had, Joint Commission D&D come through, they looked for the signature of everybody that was informed. But generally, yes, you know, usually those came from staff meetings.
Right.
when we do process them, so.
right,
But it's also a way that you can inform an affiliated department of a policy change.
sure.
Without having to go into their staff.
Mhm,
meetings.
mhm.
Now, if there's an update made and to a policy and it belongs to a certain department, and everyone gets the notification that there's been an update and that they should review it, now we'll be able to tell whether they have or have not reviewed it and get reminders in case they've
Yes.
forgotten or whatever.
Yes,
Okay,
correct, yes.
okay, great. Yeah, and so I think you just said we're putting SharePoint up.
We're gonna be building SharePoint.
Oh, that's fabulous.
After the first of the year,
Okay.
you know, just so we can get things out more commonly, we can share the proper information across.
No, that's great.
everybody as well.
Great, thank you. Okay, any other questions, comments on the policies and procedures? I will accept the motion to approve as submitted by Charlene.
I'll make the motion to approve.
Thank you, Ken. Do I have a
Second.
second? Thank you, Shelley. All in favor, Ken?
Aye.
Rich?
Aye.
Shelley?
Aye.
Sherry?
I,
And I'll vote aye. Thank you. All right, now that does take us back to you, John, number 16. Introduction to Civ Assist. Are you still with us?
I'm still with you.
Fabulous, thank you.
You just missed the dog barkery. We hope they've calmed down by now.
We had perfect timing then.
Or maybe, we'll see. So do you want to give a little intro or?
Yeah, yeah, thank you. So had some conversation with John Kennedy, he's our guest today, about streamlining our board's agenda and minutes and possibly our binders as well, making it less cumbersome. Right now, the way the process works for our agendas and minutes is it's in a Word doc, they're in Word documents, and Deborah and I send them back and forth and reformat them every time they go back and forth and spend just stupid time on stupid things. And so we were looking for a way to make that more manageable and more friendly for, I'm hoping friendly for the rest of the board also. And John has this online resource, Civ Assist, that we started looking at, and it looks like it could really help us a lot. And so I wanted to bring it to the board and see what you all thought about it, and then let John kind of speak to some of the functionality of it. So John, if you want to go ahead.
Okay, I'm here. Since I can't see your room, is there a monitor, or should I just describe it and we use our imagination to share the
We
screen?
have a screen
Yeah.
and a computer connected to it, if you want to guide Brian to a location, or if you want to share.
Okay, so in a second, well, I'll try, I'll share the screen, and since my wife just walked in, she'll make sure I can do it right. I can create software, I just can't use Zoom very well. So a little background, and I won't take too long. I was, I don't know, 5 or 6 years ago, helping some local special districts, specifically a fire district, with their meetings, and they were unintentionally violating the Brown Act just because of the way agendas were created and this and that. And they, like everyone else, use Word docs. And so I just, long story short, thought, you know, instead of being one of those people that always complain about people doing things wrong, how about I try to create a solution to the problem? 5, 6, 7 years later, here we go. So this tool that we created, like you mentioned, Jerry, takes that whole Word doc back and forth functionality just out of the picture. There's no need to do that anymore. And the way our system is set up, your clerk, Deborah, can log on, start creating an agenda, save it for later using our template. And Jerry can also log on and make your changes. You don't have to go back and forth sending Word docs and tracking changes and all that jazz. And once you've entered your items, you can move them up and down easily. And the PDF is formed without you realizing it until you view the PDF. One other thing, and then I'll start showing a couple things, and I won't take long. When you're creating your agenda, once you're done, you finish, and you've decided, okay, that's it, and you've approved your agenda, the minutes template is built in the background to match exactly the agenda. So, and I will show you in a minute, when I don't know how many times you guys have looked at different board meetings, I'm sure Sherry has, where you're looking at minutes and you can't really figure out where the heck they match up to the agenda. That's not an issue with us. So how about I share my screen and
while you're doing that, I'll also mention too that, for our closed session, we have certain government codes that we have to include in those and safe harbor language. And that's built into his system. So we don't have to go
yes,
use.
I was going to show you that. So
Yes.
the host has disabled participant screen sharing, so you'll have to do something there. If not, oh, there we go. Start your video. Oh, I don't know if I have a video. We'll see what happens here. Host,
Oh, now we see you, John.
you actually see me? Oh,
Yeah.
ew, gross. Maybe you have to start a video to share the screen. We'll see. So I'm still disabled from sharing the screen.
Can you make him a co-host?
My wife probably knows how to tell you what to do if you're the host, but I think she's, oh, hello, wife. If she's on the other end, what does she have to do to share the screen for her to allow me? I think she's just
on the share screen button. There should be a drop down arrow, and it should, if you click on it, it should give you the option to allow sharing.
Yeah, looks like I have it now. Cheers to all participants.
Try it again.
okay. Let's see, what window am I on? There we are. Share. Okay.
There we go. Now we see it.
So let me move this thing out of my way. So this is where Deborah and Jerry and whoever else would have a log on would go on, manage your documents. I recreated your agenda today just pretty quickly, but so I will show you what your agenda will sort of look like. And this is today's agenda. So don't worry about reading the whole thing. It's going to look a little different just because we're sort of rigid the way we format things. But as you can see, and stop me if I'm moving quicker than the screen, but as we scroll down, this is just my iteration of your agenda. And if you end up using this, we'll start some training and do whichever way you guys want. But you will see on this agenda, do you see the comment section there?
Yes.
Next to each agenda item.
Yes.
This is something you can turn off or on. Not sure why you want to turn it off, but you can. This is for the public side of things. For instance, if I was scrolling through and I saw this introduction to CivAssist, I could click comment. If I'm the public, it'll open this window. You fill in your information and you say what you want to say. There are notifications set up for whoever wants the notifications once a day. If there are new messages, new public comments, anyone on the notification list will get a notification. And it'll bring you to this window right here. And if there's a comment, you will see right here where there's one comment. You click on that, and every agenda item's on here, and you'll just see where the comment is. Oh, look at that. There is a comment on Introduction to Civassist. Jane Doe from Beverly Hills said Civassist is the best thing since sliced cracked sourdough bread with garlic. So coincidentally, she really likes this. So that's just a part of the civic engagement tool. I was telling Jerry earlier, this is offering the easiest way for the public to be able to share a comment without having to look up email addresses, find out who, call right off the agenda. It's also proof that not much of the public cares too much, except for once in a while. So rarely most of the times these comments go silent. So that was kind of a look of the agenda. Have I said enough for this?
I think so. I think
Now,
that's,
also, as you're creating the agenda, as Deborah or Jerry or whoever's creating the agenda, you can upload the documents to each agenda item. So
Nice.
I know you
now,
like that.
Nice. Very nice.
of course, if you're like me, I like the new techie stuff, but I also like a packet of paper in front of me so I can scribble. I'm trying to get away from that. And maybe when I'm 75, 80, I don't know.
I have scribbles
but-
all over my stuff, John.
So the public or you, instead of scrolling through a whole packet and, maybe you'll be able to change what you have to do to number and different tabs, whatever, but you can go so I'm going to go right to contract for coding. You click on the view item, it opens up and you'll see your two items right there. So same thing for all of them. So each item on the agenda, you can click right to it. So that saves some time for the public and the board. And I wish that dog would be quiet.
So I have a question. So can we have our own, bring our own little laptops or whatever and just use this?
I
And bring
see
documents
no
up?
reason not to.
You can, in fact, I'll bounce,
That board detective, pretty much my iPad.
Or a little small iPad, just bring it up?
Pull everything up right on the screen.
Mhm.
Can you make comments as a board member, as you're reviewing things? Can you make comments and save it?
in terms of, you mean, save it
Of
for,
what's what's being discussed, of what the takeaway was, if you want to make.
Probably
like-
not, because you're accessing a public document that everyone can access, so I don't think you'd necessarily want your comments and questions on. a
She's
public
thinking in
document.
terms of, like you
I
said,
hear
the
what you're saying,
scratching
though.
that we do, the
Right.
notes we take while we're on an agenda item. Could that be put under comment is what Shelley's asking.
Well,
Probably need to have this.
private comment, I think is
Yeah.
what she's thinking.
Yeah,
You probably need to have another screen open, a little note screen, and then just
Yeah,
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 have a.
because like you're saying, the comments would be public record.
right.
Yeah, so have it as a
Some of my
screen.
comments, they might,
You might not want them on there. Sorry, John, go ahead.
no, I was listening to you guys talk. So as we roll things out, when people have questions, I actually start making notes thinking, I wonder if that's a good idea or not. So I was actually making notes. So to clarify a little bit more, when you were talking about, are you just talking about making your own comments for your own
Yes,
good,
Yes,
like during the meeting or?
or before.
Yeah, well, okay, so before, maybe not, but let's say that you have, you get your board packet and you have some questions regarding each agenda item that you want to jot down before the meeting. I'm not sure that's.
Yes,
But,
I think that's what we're talking about.
okay,
Well,
so,
And during, and during.
and during the meeting. Yeah, because we
Okay.
review currently, we review the documents before the meeting. And we may, highlight certain things or make notes or,
So let's-
ask about this or that.
so let me show you this little feature. Once your agenda is approved, I did this for myself, actually. This was created as a user, as I was using it. So when I do minutes, or when I was on the board, I like to make a lot of notes. Sherry knows that. I think Sherry and I were the only ones. I would make notes or minutes on the agenda itself, and then I run out of room. So as soon as an agenda is approved, check this out. This is generated. That can be part of your board packet. It matches every agenda item. I mean, maybe this will help for whatever you were saying, but there's little squares here, little text boxes for you to make notes prior to meeting or during, just for yourself. That's
So
as
is
good as I've got
this,
right now to address what you were saying.
can the public see this?
If they want to, yeah, you can.
The blank version, but if you save it locally or.
Well, this is just a PDF. This is just something that gets printed out as a packet, or you can print it out. So I don't think it really addressed you being able to, in real time, make notes. But
I mean, as long as you have Word, you could probably just copy that form.
yeah,
that meeting notes form,
totally. That's, yeah,
and
whatever.
paste it into Word and do your own, and save it for that meeting date.
Right. Also be careful, now that we're, the notes that you're making in the board meeting, if you are like addressing it, you know, that's subject to public records request. So.
Yeah, under the Brown Act.
Not that anyone's afraid of that.
Come in and ask to see.
But you could
Not
make
that
your,
anyone, yeah.
you could still make your own
Yeah,
notes.
yeah, that's what he's saying. You want to be careful what you put on something that would be.
Oh, discoverable.
Yeah,
Sure.
as you're making notes, and you might make your own type of
Well,
notes.
that's it. Right now, we don't keep this stuff. I mean,
Yeah, and if you refer to those notes in a meeting, in a public meeting, and you got one person that's honoring, they may ask for them, and they're entitled to them.
Okay,
Interesting.
that's a good point. That's a good point.
Let me just show you a quick example of what your minutes would look like. So I created minutes for your September 28th. So here is just a, where the real time saver is the minutes. It looks like a lot of work was put into these minutes here. I didn't do them all. I just made some examples.
It's hard to see. It's hard to see.
Is that hard to see?
Yeah, but it's on our side. It's because our screen, yeah, that's better.
Okay, well, so anyway, this is a quick glance through minutes. Of course, don't read it all because that would be silly. And I could enlarge this.
Oh,
Maybe
yeah, that helps. That helps. Thank you.
This is why my wife is here. And I wish we could just sit
Thank
right
you
where
for
we're
us.
sitting.
Yeah.
So let me just show one thing. So right now I'm going to approve an agenda. Let's just pretend it's ready to approve. I'm going to approve this agenda. Right when I do that, everyone on the email list, which you guys are on, but I have it turned off right now, so you won't get spammed. Everyone on the email list, board members, public, whatever, they just got the email. This just all happened. You don't have to go email anyone. It just went out to every single person. Not really, because I have it turned off.
So John, could we
Yeah.
include on that email list then like Plymouth Sun and the other
Fire departments. and
yeah,
all
who else?
Everybody that's requested an agenda or not.
Yeah, okay.
But I think I heard the question. Is there a
Sorry.
limit to who you're putting on? Is that what you said?
Yeah, well, because we have to publish this agenda to various public places. As well as the radio station and the Plymouth Sun and Intermountain News, we also send it to. So I'm assuming we could put their email addresses on there too, but is there a way for us to, yes, this is what I wanted to see.
Yeah, yeah,
Can we-
and this
can
is
we
part,
see-
so this is part of the training later. What I did was I put all of the emails on that were on that list Friday.
Yeah.
They're all
Yeah.
on here.
Now, John, is there a forensic tracking to where we can show that, as a matter of fact, the email went on a certain day at a certain time to
Yep.
individuals?
Yeah, and as of right now, that's, you would make a request to us and we can find it, because
Okay.
that's where my coder will not let me put my mitts on,
Got it.
and
Okay,
that's smart. So you can
just
just.
as long as we know it's there.
Yeah, you can turn this off, and here's the reason I did this. One, it makes it a lot easier. Two, there is no way for your packets to go out before to board members before the public. It's all at the
Right.
same.
Right.
So, you can prove you're compliant here with that. I talked about the auto email. Oh, also, you guys, when you're done, you upload this agenda to your website. If we end up doing this, I talk to your IT person, your content manager of your website, and we can create the links to where, as soon as it's approved, it also is uploaded on your website. So it's another item that doesn't have to be done.
That's perfect. That would make,
A lot easier.
So I think I'm almost done, but I wanted to just show you something. This is the geeky part. So I want to show you why the minutes are so easy to do, and then I'm gonna shut my mouth. So we just approved this agenda. Now we're going to create minutes. So I'm doing this. See, there's no Word doc. I assume your meeting started at 3, 5 o'clock for me. Let's see, whatever. I'm just going to click around. It was called to order probably by Jerry. All these people were present. If they weren't, you can just click who's absent. I'm going to scroll down to a vote. Let's just say that the modifications to or deletions from agenda, probably no action. I'm assuming I wasn't there. You can write some text in here if you want. But I'm just going to go to approval of special board minutes. Let's just say that it was a roll call vote. You can say Sherry made the motion, Crandall seconded, everybody said yes. I'm going to just scroll down and save this, okay? And we're going to view the minutes. There was no Word doc action there at all. This was just click, 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 a little bit of text, and see how the roll call the meeting was called to order at 3:27. No one had to write that. It's already in there. Roll call.
Deborah is ogling back here.
Yeah.
So here's something funny. So Beckworth Fire used this, Grizzly Ranch, Grizzly, Gold Mountain, Sierra, a couple municipal advisory councils in Santa Rosa, one in Mendocino County. And it's sort of funny because when I showed that part, people giggle because it just makes things so much easier. So I'm just going to shut up now, and I think I showed you enough of the specific things. There's a lot more to it, a lot more features, a lot more instruction that would have to happen, of course. But honestly, I can usually set someone up on an account, give no instruction, and just say go play along, and it's so intuitive. Most people can sort of figure out most of it on their own, and I think Deborah can agree to that.
Thank you, John. Thank you very much for that thorough overview. I think that really helped everyone see the functionalities and the capability of it.
And there aren't any firewall issues, people's emails or anything like that, any kind of firewall issues?
You know,
With
we
people,
found that sometimes someone's email Yahoo for a while. Our system didn't like Yahoo for a while, and the people who had Yahoo emails didn't get it. So we will do a kind of a test when it gets going to make sure everyone gets their emails. Sometimes it'll go to spam. So the first few times we need to just double check and kind of do our due diligence to make sure everyone got the email.
yeah, thank you. That'd be great.
We'll test with Shelley.
I'll be the
Yeah.
guinea pig.
Any other questions, comments?
Nothing.
Um,
I like the guy.
Exciting.
I think he's really onto something very beneficial.
I do too.
I think so too.
Right. So with that, then I would entertain a motion to approve moving forward with Civ Assist with a not to exceed of $1,299 per year.
All right, motion to approve.
Thank you, Shelley. Do I have a second?
I'll second that, but only on the proviso that John swears he's gonna not jump ship for that length of time.
I'm here for as long as I'm here.
All right, second by Sherry, thank you. All in favor, Ken,
All right,
Sherry, thank you, Shelley,
Aye.
Rich,
Aye.
and I'll vote aye. Thank you very much for joining us, John, and for walking us through that. It's very much appreciated.
Yeah, and
Thank you, Carla. I'll be very happy too.
Jumping up and down.
Right? Oh, my God.
well, thank you guys, and Deborah will be checking in. We'll just, December will be a freebie month, and we'll just be working on it and use it, and then we'll start in January, so,
Sounds fabulous. Thank you.
okay. Thank you. If you guys
Thank
don't mind, I'm not gonna join anymore.
That's fine. We'll
Thank
see you
Okay.
later.
Bye-bye.
Okay, so next up, we're gonna go with 21. We decided to move up. That's the medical equipment overview, tab I. Medical equipment overview with request for approval for Canon imaging equipment purchase order and for needed early procurement items only. Donna, do we still have you on?
Yes, I am here.
Thanks for sticking with us.
Of course. So yes, so within your board packet, you've got, as requested at the October Board of Directors meeting, the updated medical equipment list. It did actually go down in cost with some refinement. But bottom line is that given discussions overall about the project, all we want to ask for board approval on today is for the Canon equipment, being able to issue the purchase orders for that, because we need to get the final drawings from Canon in order to get those incorporated into the design. And there's no cash flow associated. There's no cash output that needs to be associated with this PO approval at this time. It is just a commitment to purchasing this equipment so that we can get the drawings that we need. It's not this attachment. There is the quotes, the non-lease quotes. So this is related to the lease, and then there's other attachments that are associated with that have the signed quote, the signed non-lease quotes.
So this is for more than just the ultrasound?
Yes, so this is for the CT, the rad room, the portable x-ray, and the ultrasound. And so that is, all those are bundled in order to get the pricing that we have on each individual quote. And then so the request is to issue that purchase order, and then we may, pending board approval, be asking for whether we can proceed with early delivery for the ultrasound, at which time that payment would be required, but it's a separate issue from approving the purchase orders. Does that make sense?
Mm-hmm.
Yeah, any questions, comments? All right, do I have a motion to approve the purchase order for the Canon imaging equipment?
I motion to approve.
Thank you. Do I have a second?
a second.
Thank you, Ken. All in favor, Rich,
Aye.
Ken,
Aye.
Sherry,
Aye.
Shelley,
Aye.
and I'll vote aye. Thank you. Okay, Donna, go ahead with the next item.
Okay, so then, do we want to talk about the early procurement list that's also part of your packet?
Yes, I'm trying to find it though.
Yeah.
Do you know what page or
Look at the,
It might be in this book. I put it in the book.
maybe?
yeah, that second item on the, oh, nope, not that one, but go back to where you were.
Me, sorry.
Yeah,
This one
the
right here?
second one, the early
That one?
procurement. Yeah, that one.
Can you make that bigger?
It's in this book, if you guys
Sorry.
need to see it.
It's in there.
Okay.
We don't have it in
Oh.
there.
No,
Put it in mine.
no.
Can you scroll a little over so we see the totals? Thank you. Thank
No, I
you.
didn't.
Okay, all right.
So
ahead, Doc.
this is the summary of based and Judy, chime in wherever you'd like, but as I understand it, this is the list of items that that is currently viewed as needed prior to it's from the overall project equipment list. And so this bottom line would cause a deduct from the overall equipment line item on the overall report. And it's being requested by the associated department heads to get these sooner than later. I believe that the ask here is for this to be a heads up that this is something that we're looking to request of the board, but not asking at this time for approval, but that we'll review it more in line with overall cash flow at the December 20th meeting. Jerry, am I remembering correctly? Am I stating that correctly?
Yeah, that's what we had talked about. And Judy, are you still with us on the phone?
Yes, Jerry, I'm still here. So my plan is, if I understood our conversation correctly, at the December 20th meeting, I'll provide a written justification or a summary of the medical equipment that's on this early procurement list from each department head with a justification of why we need it now and some level of urgency to give us a better defined timeline when the board may expect that we're going to have to lay out this cash for these items.
Yes, with some thought that, knowing that we have some things that are on the brink and we want to make sure that we replace them before they become a problem, but also keeping in mind that we're trying to reduce our outlay where we can as much as possible. So kind of that balancing act there. I know.
Correct.
Yes.
Correct. And the department managers that are involved in this have, I feel like, a keen understanding that these are important requests to support daily operations. So it's not just because we wish we had something nicer. It's because we're a little bit on the brink of a break fix situation that we don't want to get into. So we're trying to be proactive here, even though we respect the idea that we have to look at the bottom line always.
Yes, thank you. Board members?
There is one thing, Donna, that I am still waiting for from Dave Monday, and that was potentially an almost like an accessory device, perhaps, that may need to go with that lab analyzer, the Celavision. And I still have not gotten a final word from him whether there would be additional component related to the Celavision, which might increase that overall price of the lab's needs. But I hope to have that within the next couple of days, and I'll get that to you and Casey as soon as possible.
Perfect. And then our goal would be to have this updated as to reflect that for the December 20th meeting as well.
Correct. And then, and also, making sure that we have enough counter space for everything as well. So.
Yeah. And for the 20th, if we can get an idea, I mean, if we're being told all of this stuff, we need all of this now, or these pieces we need now, and these pieces we need in February, June. I don't know. I'm just, yeah,
exactly.
It would help us.
We're trying to define, like I said, some sort of level of urgency. Like, do we need it in the next, 60 days? Do we have 6 months? Do we have a year? Whatever it is, and give you. But yeah. These are definitely not anything that we feel can wait 2 years or 3 years even.
Right. Yeah. And we'll probably have to take into mind lead times for those items as well. I'm sure you already have that in mind.
We'll make sure that that's included in the summary. Right. Thank you. Yes.
Yeah. As Sherry just said, they're not going to just show up overnight. But unfortunately, we'd like for that to happen, right? Not here. Okay, great. Thank you. Any other questions or comments on this topic?
That the total of that equipment was what, 330 something?
Yeah.
Thousand? Yeah.
there,
Okay,
which is equipment that we had already planned
right,
over here. We just, some
Right.
things we're needing to replace now.
yeah.
So, yeah. Okay. All right, so we don't need any further action on this at this point, right, Donna?
That's correct.
Okay, we will bring this back for December. Thank you, guys. All right, so jumping, oh, Steve? Or are you just
Yep.
getting ready, are you getting ready for for 17, the investment account with California Class? Or did you have something to say about medical equipment?
Nope.
Okay. Go ahead and move forward then discussing the California Class investment account, please.
Okay, thank you. So we've talked about this a little bit at previous meetings, but we're ready to move forward now that we'd like to establish an account with California Class, which is a public agency investment fund. We had previously discussed that very similar to LAIF. It has the same investment concepts as LAIF in that it follows California government code that is part of our investment restrictions or investment guidelines. But they are, as I said, much more nimble, that they're able to move their money or change their investments into vehicles that have the highest return, take advantage of short-term rates, which, as Rich we've discussed, they're quite high. So we'd like to give this a try. This is a fund that Chester Public Utility District participates in. I did run this by Best and Krieger, our attorneys, and they said absolutely we're eligible for this, and their investment guidelines are in line with what we need to follow, and they said okay to proceed.
Good, thank you. And there will be some additional changes made to the investment policy, so we're not going to approve the policy itself at this point. We just want to approve establishing the investment account with California Class, which falls under our existing policy.
Yes, and as I mentioned to Jerry earlier, kind of at the last minute, the BBK came in with some actually really solid recommendations for our investment policy that we'll be bringing back to you guys for adoption.
Any questions, comments, concerns?
Yes, what is the present short-term return? What's the interest rate?
They, right now, Rich, you can go on their site. If CaliforniaClass.com, right now they're saying that net of fees, they are earning just over 5%.
Okay. That's good.
5.1 net of fees.
Yeah,
That's-
and as a reminder to the board, this is liquid. We can request our money at any point in time that we need it. So it's not tied up for a period of time in bonds or anything like that.
Liquid means you get it the next day?
Same day access
same
to
day.
your same day access to your funds. Very similar to LAIF. LAIF, we have to put in our request by 10 a.m. California Class says that if you get your request in by 11 a.m., you get that money the same day.
Good.
Any other questions, comments? Okay, then I will entertain a motion to approve establishing an investment account with California Class.
So move.
Thank you, Treasurer Rich. Second for Ken. All right, all in favor, Rich,
Aye.
Ken,
Aye.
Sherry,
Aye.
Shelley, and I'll vote aye. Thank you. All right, Nick.
I'm a little confused for a minute, but when they were talking at the same time, I didn't see your motion and
Oh.
who seconded.
So Rich motioned and
Okay.
Ken seconded.
Got it.
Thank you.
Thank you.
Okay, so next up, staking with you, Steve, number 18, contract for coding services from R1 RCM Inc.
Yeah. So again, we've been having conversations about our revenue cycle performance post Cerner go live, which is under the auspices, if you will, of R1. There are day one outsourcing of billing. We've had some immense challenges with various aspects of the revenue cycle. And one of the areas that we absolutely have had an issue is the bottleneck with the way Cerner works, the bottleneck at coding. So what we did is we approached R1 and we said, hey, can you guys provide us some coding support? And we have an outstanding in-house coder, but she is one person. And in addition to having to deal with things like Cerner issues, which I think Brian will talk about more, and I may talk about more in the R1 revenue cycle section of what we're experiencing there, is that she just cannot keep up with it. And one of our biggest issues with our revenue cycle performance is what we call discharge, not final billed. So patient has been discharged, but we have been not able to submit a bill to the payer. And there's a variety of reasons that happens. One of which is that the coder hasn't finished their work. So when we talked to R1, we said, we don't want you to take over all our coding. We just want you to be support for our existing coding service or coding function. And so we came up with this idea where they said, hey, you give us 500 accounts per month, and we will charge you a flat rate of $2,500 a month. Essentially, it's $5 a chart, which seems like a really good deal, but I guess coders can do a lot of charts, that aren't problematic. So they said, well, you assign us 500, and actually we guarantee them a minimum of 500. And this will work really well for us right now, because last time I spoke with Shell Stoops, our coder, she said, I have an inventory of 2,000 accounts. As you see from the statistics from the financial report, we have over 700 clinic visits. So we, in essence, could give them the majority of our clinic accounts, and then we could focus on the hospital side, where we're having some real challenges through the emergency department. And then we could also have Shell continue her focus on issues within the clinic itself and things that we need to continue to address and resolve. So I think it's kind of a win-win. It's exactly what we need. It's a very small financial commitment. It's $2,500 a month minimum by giving them 500 charts. We can give them accounts, charts, whatever. We can give them more, and they'll just, if we go above 500, they'll charge us $5 a chart, and that's fine. Maybe we give them more at first, but we're looking at an annual outlay of $30,000, which we think is really going to solve a lot of our issues. If nothing else, it's going to bring down the discharge, not final billed, accelerate our cash flow, get billing out the door. But I think the biggest piece that it's going to do for us is Shell Stoops is going to be able to focus on the issues within our current workflow, whether it's the process people, the way things do things, or that there's actual a Cerner build issue that we need to address. So that's what's before you. Rich's favorite thing, we actually have an out in this contract. We do have to stick with it for a year. We can get out of it after a year. I'm truly hoping that we don't have to get out of it after a year, because what this will also do as we go down the road, if you will, is that, again, Shell is the one coder we have. She does have some help with some bit of the coding, but when she takes time off, she gets sick, whatever it is, the coding sits. And so the way this is set up, R1's just working right in our Cerner system, and we just flip a switch when Shell goes off on her time off or whatever it is, scheduled or otherwise, and they can pick up the coding right there, whether it's day one, or we just set up a thing where anything that goes beyond 5 days or whatever it is, post discharge, boom, it goes right to R1. So we think it's just a good thing all around. Any comments about our approach there or the actual agreement itself?
So I have a question. This is Shelley. So we have 2,000 accounts that are waiting, just waiting that she can't get to, bless her heart. So if we're doing 500, is it gonna take 4 months for us to get through those 2,000? Or are we gonna give them the 2,000 to start? Or is that the $30,000 you're talking about to get started?
The $30,000 is our Shelley, is our annual minimum annual commitment. We can give them more, and we did talk about that. I would envision that we're probably going to give them close to 1,000 right off the bat. You know, we don't want to give them a bunch of accounts until they've proven that they can, you know, meet our standard and support us. But I think we go into month one, and if they do well and it's working for us, I say we give them as much of the backlog as they can handle. So there's a very strong possibility that it could be more. But again, even if we give them 500 additional accounts, say month one is 500 and month two is 1,000, you know, that's $2,500. So it's something
Monthly,
Yeah.
2,500. 30,000
Yeah.
additional monthly, no, 30,000 is the annual. You said 35,000 is the annual commitment. And then in addition to that, 2,500 monthly? No, that's what.
No, I'm sorry. It really, it's this simple.
Yes, I get it.
This is
I get it.
They're charging us $5 a chart to code.
Got it.
So,
The
and we're
minimum.
giving them a minimum guarantee of 500. So they're just going to bill us $2,500 a month unless they do more than 500 charts. And then it will be $5 per chart over 500.
Okay. And I think I asked at the last meeting, of those 2,000 that are waiting to be coded, what is the dollar amount that we're at risk for, that we can't bill for
That's
because they're not
something like
coded?
There's a slide in the revenue cycle thing. Let me see if I can pull it up right now.
It's the R1. Yeah.
And this is really, I hate this. It says waiting for coding, and there's so many reasons that it could be waiting for coding. But right now, waiting for coding for whatever reason that is as of the end of October was $565,000.
So that's those 2,000 accounts.
There's other stuff in there because unfortunately, Shelley, everything ends up with coding. I mean, they have these work queues and pretty much almost everything ends up in Shell's work queue. So I don't know if that's makes up the entire 2,000.
But we'll have additional ones probably from November and then, yeah.
And I saw this Heldon scrubber. I mean, Heldon the scrubber was, you know, $196,000.
Yeah, Heldon scrubber is something that's passed through us, and now they're releasing the account to the payer, and the clearinghouse SSI is performing some kind of edit or something. It doesn't like the claim, and so it's getting held up there, and then it can get sent back to someone to make changes or whatever it might be.
Okay.
But 565,000, that's 10 days of AR of the waiting for coding. So,
Okay.
And I don't know, 565, our average charge per account is, 500 things. So there's your 1,000, there's 1,000 plus accounts right there.
Thank you. Do we want to consider including a not to exceed amount for this item?
Well, I'm thinking at $5 a chart and the return, if it's coded properly and everything's done properly, it's gonna be way more than that.
Mhm.
As many as they can do for us, I would think.
I would agree.
At least initially, for sure.
And I doubt if they would send them more than if we were broke. They probably quit sending.
That's over the send it, send it.
Yeah,
Yeah.
right,
Hmm.
exactly. Because we're only guaranteeing them the 500.
Mhm.
Yeah. Okay. Any other questions, comments on this contract? Rich, do you have anything?
No, thank you.
Okay. All right, well then I will entertain a motion to approve the contract for coding services from R1 RCM Inc.
I motion to approve.
Thank you, Shelley. Do I have a second?
Second,
Thank you, Sherry. All in favor? Rich,
Aye,
Shelley,
Aye.
Sherry,
yes,
Ken,
Right?
and I'll vote aye. Thank you, Steve. Sticking with you, moving on to number 19, the September 2023 financial report.
Yeah. Okay, so I don't know what to say. I'll just jump into it. So this is our first report, first full regular report, financial report for the current fiscal year, which began July 1. Just in the sake of time and probably more in the sake of time than anything else. For this one time, what I did is instead of doing the report for the month, I did it for the 3 months ended September. Although you do in page 3, you have the monthly financials by month. It just doesn't have a comparison to budget by month. So if you want to look at, okay, so this is the 3 months ended September. How did that happen? You can just go to this page 3 and you can look at June, July, August, and September. So anyway, in short, Brian, if you want to just buzz to page 2. So in short, we had a loss of 1,329,000 versus a budget of 1,044,000 for a negative variance of 285,000. There were a couple pieces to this. Our net patient revenue had a negative variance of 129,000. The good news of this is that we actually had a positive variance for outpatient, and that's the drum we always beat, is that our outpatient, drives the financial ship. Unfortunately, our inpatient volumes, acute, swing, and to a lesser degree, long-term care, were way below budget. And this is interesting because we budgeted for 0.5 average daily census, so half a patient per day, so 15 swing patients per month, which is essentially 1. That's about where their standard length of stay falls, and 0.75 acute. So on a month, 22 days, which could be as somewhere between 5 to 7 patients per month. We didn't even hit that. Our census for inpatient swing together was less than 1. So there was a very low utilization inpatient. Long-term care was down a little bit. We had some residents leave us, and that has come back to our expectation, where we had 14. We placed our 15th resident, and then we'll be looking to place our 16th resident, which will be a full house, although we did lose a resident recently here. But we're looking to keep the long-term care unit full or near full going forward into 2024, which will hit or exceed budget. So it's really the med surge, acute, and swing bed that hurt us. So if we get down into expenses, there's two or three common themes here. Part of our variance, or a big part of our variance in labor, whether it's our employees, whether it's the registry staff under contract labor, which is nursing and technical people, the clinical lab scientist and a surgery tech, but also our professional fees medical, which is our providers. We saw a shift in all those areas, from whether it's employed people in the non-provider arena or directly contracted physicians in the ED, that we saw a shift that we had to use contract staff. So contract registry, contract nurses, contract techs, and we had to use a higher volume of locum physicians in our ED. And both of those led to negative variance. And as you can see, it's like a 2-to-1 ratio there. As far as
That started in June, huh? Looks like it started in June. Huge bump up.
yeah. Now it's come down a little bit, and that's kind of well, you can see it here because for the month of September, our contract labor was down, so that was good in relation to certainly July, and then it came down in August, and then again in September. So now one of the things here is, due to, again, good old time constraints, I haven't been able to load a detailed budget where I go down to the account level with allocating the budget for each department. So I've had to do a bit of a high level allocation of departmental expenses by logical category. In other words, supplies, purchase service, and those types of things. And I think what I've run into here a little bit is that the timing of some of our expenditures in supplies, we had a lot of purchases for the surgery department and for the emergency department, and those would be not reoccurring expenses. So, if I was being really fair, I would move the expense budget into these months that the last 3 months, as opposed to just spreading it out over the year. Purchase service was also, I took it kind of even, was that since our collections were low, since our AR collections were low, we paid less to R1 and HRG on the wind down. So again, we'd move, those dollars into the future when we start catching up on some of these collections. But overall, the operating expenses were negative to budget. And again, it's mainly due to the use of contract labor versus employed labor, the more expensive contract labor.
To reiterate what you said earlier, though, our clinic visits are up year over year. So that's a good thing.
Yeah, the outpatient is good, and I don't know what to say about the inpatient utilization. So, but we really it will really have a positive effect on our financials if we continue tracking with the increased clinic visits. Absolutely.
I mean, admissions were slightly up, right? Inpatient admissions, looking at 22, comparing 22 to 23. No, they were down, huh? I'm looking at the wrong thing. I'm sorry. They were down because we had 20 admissions, inpatient stays in 22 and down to 11 in 23.
Yeah, but those are things we can't really
I
plan
know.
for.
How do
That's
you
why
do
the
a
clinic
budget?
is so
How do
important,
you do a budget?
because you have to, the revenue really needs to come from the clinic.
Yeah.
Any other questions or comments? Oh, go ahead, Steve.
Yeah, the only thing is, if you can go back, actually, you're right there to page 4. Oh, there we go. Perfect. So we talked about this at the last meeting. I think we'll have a discussion, maybe either at the meeting on the 20th or the next treasurers meeting we have. I think we're gonna have to take a look at that, how we've previously handled that board restricted fund. The facility capital was money set aside for specific capital improvements that and this is carry over some prior years. And then the board restricted was just kind of a rainy day fund that was established, gosh, prior to my arrival. And I've just kept putting the LAIF interest income in there. And so it's growing. But, you know, as we look at maybe the cash flow analysis that's coming up, that we may not be able to do something like this, or we'll just have to have a really a different discussion about what needs to be in there, and do we want something in there.
And you're talking about with regards to the equipment that we are looking at bringing in before we move over?
You know, that's that part's always going to be there. I'm mainly looking at like the $1 million of our rainy day fund. You know, do we want to have or AP reserve? Do we want to have a designated reserve like that? Or how do we want to present our cash? Because it's technically all unrestricted. You know, it's just that you guys at one point established putting it there. The auditor says it's really not restricted. It's designated. So just how we want to do that.
I think from the board standpoint, and Rich, maybe you can speak more to this, but I believe that the board restricted funds line item was established so that the board had comfort of having a certain number of days cash on hand to cover operations if something were to happen. Rich, can you speak more to that?
I agree with that, Jerry.
So to Steve's point then, how many days cash on hand do we want to retain that and in that manner? And if so, how many days cash on hand would the board want to see as that fund?
What is I guess the question was to Steve, because I've forgotten what is the industry standard? What would we like to see, which is pretty consistent with what others are using?
I don't know that there's necessarily an industry standard for a rainy day fund.
No,
I think it's
days cash on.
Days cash on hand gold
Days cash
standard.
on hand, Steve.
I think well, if you look at what the USDA wants us to have 80. I think we
Well, then
feel
maybe that's
better about 120.
We should never, can't go less.
So we have 95 now,
Yeah.
excluding, if we included the restricted funds, how many days would we have?
What does that equate to? $1 million.
Yeah. So it's hang on one second.
Sure.
Was there another question too? I thought I heard somebody else just while I'm doing this calculation.
Yeah, I was just wondering what $1 million equated to in terms of days.
Yeah, same thing Ken was asking.
Yeah.
It's about 1 month's expense, so I think it's pretty close to 30 days.
Mhm.
So that puts us well above the 80 days,
Yeah.
right? Okay.
Well,
Puts us well above the 80 days today, or I mean, as of September 30.
yes, adding them together, yes.
Yeah.
Yes.
Yeah. So what do we do here? We just.
Do
we need to make a change right now?
I don't think we
No.
do,
Yeah.
right, Steve? We don't need
No.
to change.
No,
He wants us to think about it.
Think about it.
He wants us to start thinking about it.
Yeah, Steve, I suggest we bring it to the next treasurers meeting. We'll have a discussion.
That'd be great.
That sounds good, Rich, and then we can make a recommendation.
Yes.
Okay, anything else on the financial report, Steve?
That's really I wanted to touch on.
Okay, then I will
there's no
accept a motion to accept the September 2023 financial report in draft form.
I'll make the motion to accept the
Thank
report.
you, Ken. Do I have a second?
Second.
Thank you, Sherry. All in favor? Rich?
Aye.
Shelley?
Aye.
Sherry?
Aye.
Ken?
Hey,
And I'll vote aye. Thank you. Okay, so that leads us into number 20, which is the fiscal year 2024 cash flow report, which I think based on things that are happening is gonna be kind of fluid, but we just wanted to make sure that the board kind of saw a snapshot of our overall, including the big project that we have for the hospital along with operations, just to give you an idea of kind of what the cash flow month to month will look like through the end of our fiscal year. So I don't know how much detail we want to go into at this point, because I imagine that we'll probably be getting a revision to this. But if you guys had any questions or comments on it, you know, to Steve's point that he's been making before, we have had to spend money before we can actually get in our interim financing and continue with our project. So that kind of is reflected in this. And we just wanted to make sure that the rest of the board kind of understands how this sits. And Steve, I don't know if you want to speak to kind of the timing that we're thinking in regards to the interim financing as things stand.
Right. So a couple of things. One of the things that kind of threw a curve at us was when the USDA said that we had to put up our project equity fund in full when we did the interim financing. Our contribution, Seneca's contribution to the project based upon the letters of condition is $8,060,000. So what this shows, what this representation shows is that how we're going to come up with that $8,060,000 at the time of interim financing, because that certainly was a concern when it first got laid out there. We said, okay, how the heck's that going to work? But what it's really all kind of contingent upon is our intergovernmental transfer supplemental payment program. So we send out about $1.5 million in February, approximately February of next year, 24. And then May of 24, we get back, again, rough numbers, $4.2 million. And then that allows us to make that equity contribution. And Brian, if you could just slightly scroll down so we can see the total cash. And then it just shows how our cash is, that we will have, rough estimates. And I've already updated this thing because we know that those $250,000 for November or December and January are probably low. And then again, as we look to doing any of these early equipment purchases, that there will be more there. So one of the most likely scenarios is that by the time we actually do get to the interim funding, and that $3 million it is a plug, but it's not a plug. We have to, per our underwriters, we have to fully fund our construction period interest on that first round of funding through the certificate of participation. They've thrown out a rough number of $3 million. So that means we need to come up with $3 million to have set aside for that. Does count to our equity contribution. But what's the most likely scenario is that we're going to incur expenses along that yellow line there, where we're going to go beyond our $8,060,000. Although the good news is that as soon as we do that, the interim funding in May and get the COP funds available, we can apply for reimbursement of any USDA covered expenses, which we're going to have, like, good gravy, $4 million worth. So we'll be able to recover any excess equity contribution. But that's why it's so critical that under that, in the May column at the bottom there, is that's cash balance at bottom there is $4.6 million. And the previous month is $3.6 million. That as we spend above the equity amount, basically more than these $250,000 amounts for December and February, then both of those numbers there The ending cash for April and May are going to come down, and we just need to be aware of that. It's a temporary dip, but it's still something we just need to be cautious, especially when we set targets for our cash on hand days. So, like Jerry said, lots of fluidity.
Yeah.
Thank goodness it's in an Excel spreadsheet.
Yeah,
So,
and-
Steve, I'm looking at this, maybe this is a dumb question, but cash and cash equivalents, I'm assuming this includes the board restricted funds?
this one does, you bet.
Okay,
This is all of our cash in hand because where those amounts, where the board designated reside, they're all considered cash and cash equivalents. They're fully liquid, so we can access them at any time.
okay.
Oh, good question. And, you know, we had previously been talking about interim financing potentially hitting earlier, but you can see that it makes a lot more sense to plan for it out in May after we get our intergovernmental transfers back in. That way we're not dipping too low, critically low in our cash.
Right.
And we discussed that and how it might impact our dirt work in the spring, but we had talked previously about that work starting in April, and we wouldn't expect invoicing to happen until starting in May. So that seemed to make sense still with our current project timeline. Correct me if I misstated anything, Steve.
Nope, that's all good.
So Steve, is that 3 million in May, that intergovernmental transfer, is that guaranteed?
The QIP.
Uh-huh.
Yes, it's been approved by CMS. It's all down to the transfer actually taking place, and then the managed care plans getting their money. So there is a little bit of talk about doing the same thing they just did. If you look at back to, holy cow, back to October and November, the HQAF got delayed. That was supposed to happen back in fiscal 22-23. And so when they finally did do this in October, it was almost like an instantaneous that we sent the IGT in October, and then like 2 to 3 weeks later, we got the supplemental payment. There's talk that they're going to try and do that with rate range to do that in April, do a IGT and then basically a quick turnaround on the supplemental payment. That one's not for sure. What's for sure is at a minimum that within this current fiscal year, 23-24, we will get both rate range and the QIP. There's also additional conversation about getting rate range back on track where it would be a fall program, where we would send our IGT out in September and then get our supplemental payment back by the end of the calendar year or December. That one's still in discussion. But what you see right here is the closest thing to for sure that's there.
Okay.
Any other questions on this, board members? Thank you, Steve, for going through this. We really appreciate you putting it all
Thank you.
together for us too.
Okay, stay tuned.
Okay, all right, next up, Donna, do we still have you?
Yes, I'm here.
All right, you want to go ahead with the critical access hospital updates,
You
please?
got it. Alrighty, so EMS helicopter landing site, we did receive additional confirmation from Division of Aeronautics that what we have, the letter we have from the Office of the Sheriff and Emergency Services is adequate and no further action is needed. So I would suggest that this item is resolved. We're incorporating it into the design and no further tracking is needed. So I will be taking this off of the report to the board.
Sounds good.
Okay. Harvest plan. I anticipated when I wrote this report that we'd be complete on all the tree removal. We are complete on the tree removal. There's still some grinding going on out there, but finishing up and should be completed shortly and definitely completed before before true winter comes. So that'll be a good thing to be ready for any construction in spring of 2024. We
Donna,
we will be getting a letter from the earthwork special inspection company. BSK was out there with the tree removal folks and are going to be writing a letter to make sure that we have a good handoff for the grading, to make sure that our pad of the building and area of the under the parking asphalt is all compacted as we need it to be to have a good foundation.
So Donna, I think you had a question.
I just have a quick comment. I wanted to alert everyone to this fact that I have a great blue heron who's taken up residence in my
I
backyard.
saw it
Oh,
I told you, I saw a heron in our.
It's our homeless heron.
Okay.
It's supposed to
How
travel
nice
south,
of you
isn't
to
it?
provide.
Yeah, makes a lot of noise.
you're not planning on
It's gonna
building
get cold.
anytime soon, are
That's
All right.
funny.
Sorry to take us off track.
it's gonna get cold here soon. Yes, it needs to go
Yeah,
south.
they winter here sometimes
Yeah.
though.
Yeah, the
Sometimes,
noise
yeah, I've
is
seen
good
them in the
out there.
winter before.
I have two.
Yeah,
Really that loud, huh? Wow.
Sound prehistoric. I do.
we should record it.
You have to open your garage and put a heater in.
Go ahead, Donna.
Alrighty. Well, we don't have any risk of that now with no tree. The only trees, there are a few trees that were left, but we'll we'll count on the blue heron's tree being gone. We'll have solved that problem. Okay, moving on to Wildwood easement. No update from the 1026 board of directors meeting. I'll touch base a little bit farther down. Oh no, let me go ahead and touch base on that here. Oh no, I've got to touch base on a little bit farther down. So yeah, no updates on the Wildwood easement. Financing, working through the letter of conditions with USDA. We did receive an update as far as the other funding. We did receive an updated proposal from BKF for potential grant prospecting services. That proposal is being reviewed for determining next steps. So we'll be I can report back at a later date on whether that is something that the team is recommending for additional funding. Donor packets are complete, and I know Shauna and Chelsea have been working on getting those out into the community. So that's exciting to look at the philanthropic side of the funding. There's no updates on the Senate Bill 395. No one that we are aware of. No other facilities have gotten any 395 funding. So we don't know if and when that's moving forward. Schedule, no update from the 1026 Board of Directors meeting. We're still aiming to begin construction in April. The budget, as we're all aware, the construction costs are showing overruns. Still, goal still remains at 55.5 construction costs and 72 million overall project costs, and we're continuing to work to bring that scope and cost back in line. So teams working diligently on that. For the design, we did get confirmation and a contract with Peninsula Fire to agree the site to agree to review the site for fire control and access. So they're in the middle of that, and we expect comments back shortly. We need that again for the for the HCI review. They require a sign off by the local fire authority that they have reviewed and approved the site.
And we're grateful to Penfire for stepping in and helping us with this.
Boy, that's.
Definitely.
Absolutely.
Yes, thank you for that acknowledgement. We resubmitted for HCI or to HCI for the shell and core. Expecting response from that resubmittal in December, and the interiors design was also submitted to HCI for initial review at the beginning of November, and expecting end of January, beginning of February response to those drawings. So moving along on design. We've talked about medical equipment. I don't believe we need to revisit that. I think that was addressed in the item 21 of the meeting agenda. Construction, we obviously are not bringing the GMP here today. We need additional time to develop the final construction costs. More info to come in December on that. And no update on this notice to proceed 3. When I wrote this report, there was different circumstances, so this will be revisited as well, just so that the board is aware.
Great, thank you, Donna. Any questions for Donna?
Nope.
Great, thank you very much.
Thank you.
Okay, Steve, I think you're back for our R1 revenue cycle report for October.
Yep. So I think we hit on some of the real highlights of this report and some of the issues we're facing. I think that September is just a rough story. I will say this though, we did finally in October and here again in November have finally been able to get some of our long-term care claims paid. And this is significant because a lot of what's driving our AR days and the way I report them is that in my financial report, I'm saying our days in accounts receivable are 91.5. What you're getting here from this report right here, where is it? Yeah, in the AR and aging, the top line total AR, the September columns 59 days. So yeah, what that is that's Cerner revenue. So from June 5th forward, they're at 59 days. So that's not horrible. That's not great. But what's really driving our numbers bad is the long-term care. And as of September, we had $890,000 in outstanding long-term care. The good news is it only grew to 942 in October. And then we've had 2 pretty significant payments here recently in November. We appear to have solved all of our issues with California Health and Wellness. We have one related issue with one of their products, managed care products. One of our residents got assigned to one out of Kern County. So it took a while for them to acknowledge, yes, that is our person. And now they're working diligently to get that resolved. And that's my goodness, that's it's almost $200,000 in AR just from having to get someone to admit that, yes, that's our person. And yes, we need to pay for it. And we finally got there with just an incredible amount of work. So the other thing is Partnership Health, which will be our managed care plan going into January 1st, is we're still having some issues based upon the way we have to bill for that. We're coming down the home stretch on that one. So we'd like to think that by the end of December, the long-term care AR will be significantly down. And if we go back to the cash flow, we can see how as we go into early 2024 that we're showing positive cash flow from increased accounts receivable collections, and we don't have any reason to believe that won't be achieved. And then with the contract y'all just approved to get some support for coding, that'll bring down this $59 or $59, 59 days we're looking at here. So September's just not a good report, but we've made some progress along the way, and tonight was a big step forward with the coding. I think that's really all I wanted to cover, unless there was some other matters that came up through your review or otherwise that you wanted to talk about while we're on this item.
Bruce, do you have any questions for?
I do,
Go ahead.
painfully. So October of 23, on page 3, the scoreboard for October, it says the denial rate is 18%.
Uh-huh.
What is our benchmark for denials?
5.
Yeah. So, I know for September it was high, it was 23%. So is that long-term care?
No, those are being driven off of hospital claims, clinic claims. We don't even count. In this statistic is all Cerner. Long-term care is billed out of Americare. And those denials, as I don't know if somebody can go to that slide.
Page 7, is that the one?
Yeah, that's your denials, you'd be in 1,500.
Yeah, I mean, there's
Full denials.
I guess you know what, glass half full guy here, is that a high denial rate with us this new or this young into our Cerner go live, it really is reflective that we're getting more claims out. I know that sounds lame, and it is, but it just means that we held claims for so long that part of what makes it difficult for us is until we send out claims, we don't know whether we've set everything up right, that the payer is going to accept it. Yes, we can get it through the clearinghouse and it can go through, but then we don't know what the payer is going to do with it. So, and this is a new phase for us. For them, with R1, it really was about clean claims. And this October report, it says 76. We're now over 80% on our clean claim rate, which is getting very near our target. We're 85% is our target. So to have a clean claim rate, which just means that it goes out through the clearinghouse without rejections or edits. Denial is when it goes to the payer and gets returned. So the fact that the claim is clean is really a positive thing, and it took an immense amount of work. Now our focus will be on addressing these denials and fixing the issues surrounding them.
Thank you.
Anybody else have questions for Steve on this? Okay.
Okay.
Thank you, Steve.
I have
Appreciate
one.
it. Yes. go
Well, I
ahead.
have one general heads up for the board.
Yep.
Is that today ended our relationship with HRG as far as self-pay and patient pay. So we closed down the portal on our website where patients can make payments directly through that. They can go log into their account and make a payment on their account. They can still send in checks. They can still make payments over the phone to us. There's a notice on the website, and we'll get a little more detail. But the last statements from HRG to the patients went out here in the last week. And so there will be no further statements coming out from HRG. We're in discussions with a company we work with to try and work the remaining bit of our self-pay. There's some dollars in there. There's a lot of stuff that is so old, it's just been sitting in there, that will just be written off due to its age. We can't collect on it because we haven't done activity on it. And then there's stuff that's ready to go to bad debt right now. So the patients will, if they have questions with their Evident accounts, but here we're talking 6 months back. So there really shouldn't be questions about their account. It should be more to make sure that they can make payments that they want to pay. You know, if they got a statement, then they can send in the payment. It's just some of them like to see a statement every month and then they send it in with the payment. So we'll be working on that in the next couple weeks. We're also working with HRG to transition what'll happen with people that were set up on auto pay. So I guess more to follow on that. Bottom line is if they are having problem with their Evident accounts, patient self-pay, they're going to need to go through us for the short term, and then with the new group when we get them on board.
So Steve, on that, if someone sent a check in tomorrow and it went to HRG, then what happens?
It won't go to HRG. It'll come to us.
Okay. I don't remember what the address is on the statements.
Yep,
Is it our address on the statements?
it is.
Okay, okay.
Good.
Thank you. That's what I wanted to know.
Yeah, the only payments they were taking was credit card payments over the phone
Got it. Okay.
or through the portal, whatever. So same thing.
Thank you.
Yep.
All right. Any other questions?
Nope.
Okay. Thank you, Steve. Thanks for
Yep.
sticking with us.
Yep. Thank you.
All right. Do we still have Sean? I know he's 3 hours ahead.
Yes, he is still on.
Sean,
I'm
are you
still
there?
here.
Oh,
Yep.
thank you. Sorry for keeping you.
Dedicated.
Still here. No problem at all.
It's your turn.
Okay, well, it's my turn. Okay, so my report, my new hospital build effort report has been pretty much covered by Donna in completion. It's just a reiteration with a little bit of a few more adjectives and descriptors, more or less just the same thing that I did attach in my report, the letter from Sheriff Johns for the board to see. And that was with the Department of Aeronautics and being the public safety agency that signed off on it. So I just included that in the board packet for you to look at. If not, if there's no other questions about that first part, I'll just move on. No legislative updates. Jerry and I did meet with Congressman Kiley on the 20th at his headquarters in Rockland. We discussed the new hospital, the Lake Elsinore Basin Economic Development request. We talked about a lot of different things in the short time that we had with the congressman. The big one was he would like a follow-up letter, describing more or less the situation with the USDA and the shortfall. I am putting that letter together. That's in draft at this point, and it'll go off to his office. And then he did say in our meeting that he'll walk across the street more or less and see what he can do. So we'll see what happens with that. But the letter will go off explaining exactly the situation, and we'll see what the congressman can do for us on that. No legislative updates as far as things that are going to hit us from behind anymore at this point. COO recruitment's going well. We did our second interview before I left. We'll do the third next week. And then final selection completed by mid-December or the first part of the year. I want to thank the board members that have been involved in this. Your participation has been very, very, very effective, and it created a different spirit, if you will, to our interview process. So thank you. The Cerner conversion, there's really nothing to talk about. We continue to work through some small build issues, and Steve makes it very clear about some annoying issues relates to our billing, whether it's a build issue or whether it's a training issue. We are going to continue to work on these. That is something that we are going to stay focused on for a long period of time so we can smooth out these issues. Policies and procedures software that was discussed earlier. There's a mistake there. It's MEC, but it's actually MCN. Further down, that is going to be going forward. And moving forward with that new payroll system, we have moved away from ADP to Paycom. So everybody's getting used to the new payroll system and timekeeping system. Seems to be going okay. It's like anything else, any other software changeovers, a few bumps and bruises along the way, but I think people will start developing into their workflow, and it creates a much more deliberate workflow, if you will, as it relates to clocking in, clocking out, PTO requests and things. So we think it's going to be good for us ultimately. Physician recruitment, mid-level. We interviewed Kevin Lundell, FNP, Dr. Delienbach, and Alfred Fernandez. We're still working through some of the things with them, but we did interview them. We did make an offer that was accepted. We're going to have a new family nurse practitioner, Larry Kohler. She'll be joining us in January. She is going to be an outstanding addition to Seneca. She's got a great personality, years and years of experience in family medicine. We think she's going to be outstanding, which is going to add to our clinic and a permanent provider for people to establish. So I think that's going to really help our numbers as well.
Where is she
And
coming
then I
from,
just want,
Sean?
she's coming from Las Vegas.
Thank you.
You bet. And then the last part of my report is just wanted to present some of the analytics we're able to pull. This is more graphical depiction of numbers. This will be month over month by provider. I can do lots and lots of these different things. I can do it by ER. I can look at acute. We can look at each one of the ancillary departments. But I wanted to put these in front of the board for your comment as to whether or not these are the types of things that you would like to see in a visual perspective. The first two is obviously that was September volume by provider in the clinic. The one before after that's October volume by clinic, and then I'm rolling it up into the monthly volume month over month with a budget line and a goal line. The green goal line is 850, puts us at about 10,200 to 10,200 visits per year, and the 676 or the budget line literally is what we've set the budget at. I will make a note that on the November one, it has gone up because this was only through the second week of November, and I wasn't able to add it to this report before I left. But that budget line is what we need to strike just to hit budget. And then of course our stretch goal, we are adding another provider. So I do believe that stretch goal is not that much of a stretch goal. I think it's going to get there. We're going to really be working towards getting that outpatient volume up and rolling. And then the last one is just year over year comparison when it comes to our budget or our volume in the clinic year over year with the budget and the goal lines inserted as well. So I would love to take questions about these. I think that if you want me to tweak them, it's very easy. It's all set up in pivot tables now. So very simple to create these, and these will be part of my report going forward. Any questions?
I think this is was a huge step in the right direction to keep us kind of informed about how the clinic's doing, how everything's doing. So, yeah, nice. We can tweak it, I guess, as we get more familiar with it, but this is a really useful piece.
Yeah.
Yeah,
Yes,
I think.
helpful to have a visual.
Yeah, it's easier for me too. Visual references are always so much easier to just do a quick glance and kind of know where you are and where you're sitting. So we can dive deeper into these, and I will be creating more graphs, with a little more specificity and detail. But I just wanted to see if these were where you wanted to see this going, and continue to tweak it.
I like it. I think personally, for me, the ones with the volumes, I think I'd be okay with it just being a month rather than by week per provider. But that's up to the rest of the board, what you all think. I just think it might make it.
Month is fine, yeah.
That might make it easier for you and a little less busy.
Yeah, these are month by provider, not well. Oh, I see. So you just want to see it month over month by provider versus weekly. Okay, yeah.
Right,
Okay.
because I don't think we necessarily have to know which week they take vacation.
Yeah. Yeah, and I can tell you that, if you look at the one down there where it's the monthly total clinic, like calendar clinic visits for
Yeah.
November, we had a
Yes.
whole weekend there where there was several on vacation and the holiday. So
Oh, so that's why you're trying to show it that way. I see. Okay. I mean, we can
Yeah.
keep it that way if you think it makes more sense.
I can roll it up any way you want. I have the data. All I have to do is just graph the data. So it's pretty simple.
Well, why don't we keep it this way for now, and then we'll decide maybe next time if we want to see it differently.
Okay. Well, I just wanted to share with the board to see if we're going in the right direction as per your request.
That's nice dashboard. I like it, visual.
Yes, we like this very much. Thank you very much for putting this together. Yes.
Excellent. We'll continue to tweak it and make sure you have a visual reference. And that's really all I have for my report.
Perfect.
Thank you.
Anyone
Thank
have
you.
any questions for Sean? No, thank you.
Is the board okay with my dropping off?
Yes, yes, thank you, Sean.
Okay, thank you all.
Bye. All right, so Judy, are you still with us? She may have dropped too.
Yes, I'm still here. You
Okay.
can't get rid of me that easily. So I think my written report is pretty straightforward, but there are a few things that are not in my report that I feel are worthy of mentioning to this group right now. You know how dynamic things are, and we've encountered a few things in the last week or two. First of all, right now, if you're not aware, we've truly been experiencing a viral illness outbreak since a couple days following the Thanksgiving holiday. It did begin initially in our long-term care unit, but now it's really affecting our workforce as well. Thankfully, it's a very, very short-term viral illness, like maybe a couple of hours to a couple of days. But still, we have had a lot of call-offs for employees all the way up until today. And so we're scrambling even for tomorrow. When you have a registration staff of 3 in the clinic and 2 of them call off, you're immediately in crisis. If you have 1 RN in the ER and they call off, you're immediately in crisis. Again, this is a very, very short-term viral illness, but it has kind of taken us to our knees a little bit this week. And I just wanted you to be aware, only in case you hear something from our community about this. We're doing the best that we can and pulling staff from wherever we can to make sure operations are still safe and effective. The second thing that is not contained in my report.
Is there COVID involved?
COVID is a minor player in this. We're seeing a little bit of COVID, but even in the COVID cases we're seeing, it's a very short duration with minimal symptoms. What we're actually seeing is more GI symptoms. What we saw coming through the long-term care was some vomiting or gastric reflux, a little bit of diarrhea, and that's what we're seeing mostly in our workforce as well. We did not have any COVID in long-term as well, but we've seen a little bit of COVID in the community and a tiny bit within our workforce.
Because I'm reading there is an increase in COVID in this country,
Yes.
but it's a milder version.
Yes, and there are reports that some of the new COVID cases do come with GI symptoms, but for the COVID cases that we've been reviewing, they've been the general sort of, malaise, congestion, cough, that sort of thing.
Thank you.
Yeah, of course.
Yeah,
The
thanks,
second
Becky.
thing I'm sorry, go ahead.
Sorry, go ahead, Judy. I was just saying, thank you for updating us on that.
You're welcome. The second thing I wanted to report on is there is a new Assembly Bill 1557 in California. We've been monitoring it along with our pharmacists throughout the summer. There was a waiver that was in place, but unfortunately we learned 2 weeks ago that AB 1557 is going to pass and becomes effective on January 1st. And what this means is that, as you know, we don't run a pharmacy, we run a drug room, and we have remote pharmacists available to us 24/7. We rely on them to do our initial medication verification for us, especially on our acute care admissions. And the standard of care is that all of your medications will be verified with a pharmacist prior to your first dose as often as possible. That has not been a problem for us, except for AB 1557 requires that not only do you have to have pharmacists that are licensed in California, they actually have to be physically located in California to perform this medication verification. Of our 3 pharmacists, 2 of them are located about 15 minutes across the Nevada border.
Yeah.
So as much as we realize how ridiculous this is, we're still trying to figure out how to do the workarounds. I did speak with a pharmacist from Enloe Medical Center today who may be, because she does live in California, may be interested in assisting us with this remote medication verification. And again, they get into our Cerner system, they look at the doctor's orders, they look at any medication interactions, allergies, et cetera, making sure that the dosage or the antibiotic or whatever it is appropriate, and then they give us the go-ahead to administer. But what this really means to me is that this is just going to cost us money. But we're doing the best we can to try and figure out how we're going to accomplish this by January 1. But thankfully we have, an entire 31 days to figure it out.
So
And then the
Judy,
third,
Judy,
yes.
does the pharmacists have to be licensed in California?
Yes, they have to be licensed in California, which is not a problem. All of our current pharmacists have dual licensure, between Nevada and California, but it's the physical locality, which I don't know how they could
How can they
actually
determine that? I mean,
How can they determine that?
They
I
can't.
know.
they
And
can't.
so, Ray Duro, who's one of our longtime pharmacists, is even willing to drive 15 minutes to cross the state line. But I'm like, Ray, how are we going to prove that, when your business is actually located in Nevada? And thankfully, honestly, Rich, we have a really conservative pharmacy staff, which I love because I don't like to be on the radar with the Board of Pharmacy ever. But at the same time, there has to be some exceptions to this rule for these very remote locations, because I think there's a lot of critical access hospitals in Northern California that are going to really struggle with this. But in the meantime, we're trying to show our best of every action that we're taking to try and meet this ridiculous regulation. So if we were surveyed, we can go, this is what we're up against here. This is everything we're trying. But if anyone has any other suggestions for us, or you've got a good friend who's a pharmacist in California, I'd love to meet them. And then the last thing is our QA medical director, who is also the medical director of our laboratory, Dr. Mindy Robbins, gave notice this morning. She will continue to be our laboratory medical director, but she no longer wants to be the chairperson of our QA committee, which is something that is incredibly important to our facility. And so I'm going to need to identify another physician to take over the responsibilities of our QA committees for all departments, because obviously this is a very important regulatory aspect of our operations.
Yeah, certainly. She's willing to stay on for a period of time while we sort that out, I'm hoping.
This morning she just said we had a QA meeting today, and we've got one more in December next week. But she said, come January, her focus will only be on laboratory operations, especially given the fact that Dave Monday has given his notice of retirement as of January 31st. So she feels like her attention is needed more on the medical directorship of our laboratory than overseeing the QA aspect, but I do need a physician oversight. So there's just a lot going on right now, and I'm just throwing it out for food for thought, because you guys are often very helpful here, and just to let you know some of the challenges that we're facing over and above anything I included in my report.
Judy, this is Shelley. So I'm wondering, regarding accessing the pharmacist to do the medication validation. What about PDH? Because they're a critical access hospital. I mean, maybe we could reach out to them and find out who they're using.
Yeah, so I've had this discussion with Dr. Nielsen, and he was going to reach out to PDH to see, but from my pharmacists, they say that they got the impression that maybe they were not going to fully comply that they were going to potentially now, and this is just hearsay, so I don't know if this is true, but potentially they might wait until they were, they had a regulatory agency come in and say, you're not doing this correctly before they attempted to make any corrections. Because a lot of us share the same pharmacist, as you can imagine.
Wow, okay.
Um,
So that is a lot. That is a lot, Judy, on top of everything else you
Yeah.
put in here.
Yeah.
That's
It was
enough, Judy.
interesting because I was contacted by a telepharmacy company that was based out of Washington State, like right after this AB 1557 had been approved. And I thought they were reaching out because they knew. And so I met with them. We had, a Zoom meeting, what have you. And I said, here's our dilemma. I'm sure you guys are well aware. And I watched all of their faces fall because they're providing remote pharmacy verification for hospitals all over the country, and their pharmacists are not located within the state. And they had no idea. So they're contacting the Board of Pharmacy themselves to get their own clarification. But this is, again, it has to be some pharmacy lobbying thing. I don't know what it is anyway, but again, it could be tricky, and I just want to keep you all abreast of what's happening here.
Great. Yeah, thank you for that, Judy.
you.
And, if there's anything we can do, we'll try and put some thought around the challenges that you're discussing and see if we can come up with some ideas that maybe you may or may not have thought of.
Yeah, and unfortunately, I feel like sometimes the solution is financial, and that's very unfortunate for us right now. So,
Yeah. It is.
but I'll keep you updated on anything that I learn. And
Yeah,
that's all I have.
Yeah, because the pharmacist that performs the service, it has to be a 24/7 service.
It's correct. And so,
Yeah.
like on the weekends, Ray divides up his on-call time between another pharmacist. But again, that pharmacist is also located in Nevada. So, they try and do it in such a way. And if we could get enough that, it was spread out so it's not such a 24/7. And again, our census is so low that it's not a big deal, except when it's 3 o'clock in the morning. And, then it becomes a big deal that you have to get up, look at your computer, make a educated guess, decision on whether we're delivering the safe medication that was ordered from the emergency room or wherever. But so yeah, a lot of challenges lurking out there.
Well, thank you for that update, Judy. We really appreciate it. And
Yeah,
we
no
really
problem
appreciate
at
you
all.
sticking on to the end too. One of our
No
longer
problem.
meetings.
Okay, thank you so much.
Thank you. All right, that moves us on to our departmental reports. We already had our compliance report enclosed. Do you have anything verbal you want to say, Brian, for the IT? Is it beyond what we've talked about?
Yeah, I mean, to go along with Steve, after our last meeting, did a lot of digging into workflow. And I looked at my old hospital, and as well, the mayors went by that discussion with them. So, workflow clinic wise, Cerner has 4 steps for the diagnosis to drop to the charges. What we're talking about for Shell here is in the ED, there are 5 ways for a physician to place an order. One of them drops the diagnosis on the charge.
Interesting.
And through the training I had at my old facility, the training here, and when I was talking to the mayors, the training there, Cerner is more concerned about the clinical and the charge dropping. So yes, the order gets placed, yes, the charge dropping. Not what happens to the biller in the back end. So that's where I've been focusing on since I re-educated the ER docs. If you can, use this way because it takes that much of a load off Shell. Now, the docs are here all the time, Brink, Nielsen, do it great. It's the locums. And, hopefully with, Sean working on a great plan to get more stability there. So hopefully we can lessen that load on Shell on that side as well. There are a couple build issues. The charges drop correctly, but the naming structure was odd, so they were picking the wrong injection, so we're cleaning up some injections in the clinics, that's what's gonna hold some of those charges back up, but we're, between last month and this month, we really understand where.
Yeah,
the
of course.
slowdown was.
So when we onboard new physicians in the ED and we do their training,
Yeah.
we're gonna ignore the 4 ways that don't drop charges, right? And just train them on the 1 way that does.
Just tell them, we
Yes.
only have one way to do
I
it.
can't stop them from doing that, and one of them has a big red asterisk. Because it's to remind you to discharge the patient. And you can always order from that one that's standing out with a big red asterisk.
Interesting.
So, once they get it in mind, it's an actual easy way of doing it. And so.
You have to get it ingrained in the
And then
process.
it's just,
Yeah,
you know, there's gonna be ones that creep through, it's just reducing the load, that job will help a lot.
thank you. Any questions for Brian?
No.
Rich?
Only
Still there?
one comment, Brian, I don't, you know, for those of us on Zoom, there's a lot of flicker in that camera.
Yeah, I think we've got a bad cable,
right.
so, we'll think through that, I'll bring it on the laptop and do 2 sessions to see what's going on.
Yeah, we lost audio for a little while earlier too, but then the Ethernet cable, I jiggled that I think is what got it back. So, but yeah, thank you. And thanks for staying with us too. Yeah. All right, so HR report. I think this was very clear. I didn't have any questions. Did any board members have any questions? I love the newsletter.
I did too.
I absolutely love the newsletter.
I do too, it's really informative.
They do a really good job.
I think it's fun.
It is fun, and that's what makes it so nice, I think. So then we have our marketing and PR report. This was from Chelsea. So I've seen the donor brief. I don't think the rest of the board maybe has, but it is actually available online. So I will remind myself to ask Chelsea to send that link out so everybody can see it. Oh, that's it. Yep. It's also available. You can also view it online. So
Nice.
I noticed one, these laying on the table when we were
Okay, you
interviewing.
went ahead
Yeah.
before you leave.
So has the donor brief been modified to remove the,
no, because we
Yeah.
aren't discussing that at this point in time. It's
Okay.
drafted as is, yes.
thank you.
So, yep.
These are just drafts.
No, it's,
Okay.
that's the version
is the
that's
one
being
that's going
distributed
out.
right now.
Nice.
Yep. So now the letter that was in our board packet last meeting or last month, I think, that one Chelsea was sending out this week. I think it's already gone out. So we should start getting those in our mailboxes. And then this is for us to bring around with us, when we're talking to people about donating and for our administration to do it as well, and whoever else wants to from our staff.
Fancy.
Yeah, Chelsea put that together. She did an excellent job with it. So anyway, wanted to make sure, thank you for having those.
Yeah,
handy.
well, I'm gonna get Ken one in just a minute.
It's perfect.
Okay.
Okay, so that moves us on to number 27, fourth quarter joint committee meeting, which is scheduled for December 7th at 11:30 here in the conference room. And Ken and Rich were originally assigned, and so Deborah's asking for confirmation that you're both able and planning to attend.
Put it on my calendar.
It is on your calendar?
I put it on my calendar.
Perfect. And Rich, what about you?
What date is it, please?
It's December 7th at 11:30.
I can't confirm. I can't. I don't know if I'm gonna be back next week.
Okay, will you know, let me see if I have. Give me 1 second.
I will know Monday.
Yeah, I'm not available, so if you're unable to attend, would one of you be able to in Rich's place?
It's at noon.
11:30.
11:30.
Lunch will be provided.
Yeah.
In case that makes a decision.
If you
Are you
can't,
trying to buy participation?
yeah. If you can't, I can.
Okay, yeah, I can't be there, but, so Rich, how much advance notice do you want to make sure you get?
Oh, just a couple days.
So Rich, will you know by the
I will
5th?
know Monday.
Oh, okay, Then if you can let Deborah know, then she'll know whether to ask Shelley to come.
Mhm.
It sounds perfect. Thank
Will
you.
do, will do.
Well, this is really ambitious. Ask us about sponsoring a surgical suite.
Yeah,
Oh.
well, you don't know unless you
How
ask,
many
right?
people work? How many people know that can do that?
All right, so our next special board meeting is going to be on December 20th at 3 PM here in the conference room. And our next regular meeting, as per our change in dates, is going to be January 4th at 3 PM, also here in the conference room. And with that, our meeting is adjourned.
Yippee.
Thank you all for sticking it out.
That was a good meeting.
That's the record for us.
It's pretty close to a record for us, yes.
We used to take great pride in, remember we heard all these stories